All right, now President Yoweri Museveni has moved to quell anxiety over the expected exploitation of the country's oil and gas resource. Museveni told experts and investors that revenue from Uganda's oil will only be used for capital expenditure. He called for more emphasis to be put on the development of other sectors of the economy, especially agriculture, which will continue employing a majority of Ugandans after the exploitation of oil and gas.
And if you want to know that, you look at Japan. Japan has no oil, has no minerals, has no even agriculture. However, until recently, Japan has been the second richest economy in the world.
And still in Uganda, the Ministry of Health has brought down the number of pediatric deaths at Mulago Hospital, Kawempe, to one child a day, down from the reported 15 deaths announced by Dr. Michael Bukenya, the chairperson of the Parliamentary Health Committee. According to the State Minister for Health in charge of general duties, Sarah Opendi, the deaths are not connected to the absence of senior staff officers or postgraduate medical doctors, but rather are due to delayed response to labor calls by mothers.
15 bafa buli lunaku ku ddwaliro e Kawempe olw'okuba abasawo batono ate ne kireetera obuzibu nti we bandibalongoosereza balwawokko.
This is the statement that has created fear among the public regarding the state of Mulago Hospital, the country's main referral hospital. The death of these babies had earlier been attached to the lack of intern doctors who left the facility after the closure of Makerere University. But Sarah Opendi, the State Minister for Health in charge of general duties, says this information is completely baseless.
We as Ministry of Health would like to strongly refute these allegations as baseless and a total misrepresentation of the facts.
Opendi, however, acknowledges that the death of newborn babies indeed occurs, but is only one per day.
Since the withdrawal of the senior house officers on November 1st, 2016 to date, Mulago Hospital, and I want to state this very clearly, Mulago Hospital has unfortunately lost 31 newborns. Mulago Hospital has lost or loses approximately 1 newborn per day due to unavoidable circumstances.
But the minister's statement contradicts that of the director of Mulago Hospital, who announced that in the month of October, the hospital witnessed 56 deaths.
What you have been given, 31, was in the month of November. In the month of October, we lost 56. Unfortunately, 56.
Government has also put it that these deaths are caused by preventable circumstances where expecting mothers delay to get to the hospital, but not the absence of intern doctors.
These deaths are a result of preventable conditions, but because the mothers come very late into the hospital, they have prolonged labor, so the children die inside the womb because of asphyxia. Asphyxia means lack of oxygen, not the oxygen that is in the pipes, but lack of oxygen that when the child is still in the womb.
Sabit Joseph, Sampol Nahaima.
Well, let's now link up with our Solomon Seranja, joining us live from Kampala, Uganda. Solomon, a very good morning to you. Talk to us about the state of healthcare in Uganda. I mean, when it comes to Mulago Hospital, the reports were that 15 babies die there a day in the Kawempe branch, but the state is dismissing these claims, actually blaming the statistics on the mothers, saying that they're responding to the labor calls a bit too late. Talk to us about what's going on there.
Well, I think the bigger thing that President Yoweri Museveni's government needs to address immediately is the issue of the senior staff members there, and especially the postgraduate medical interns. Now, these are doctors, for example, who have finished their bachelor's degree and have gone back to medical school to study their master's, maybe specializing in surgery, gynecology, so to speak. The challenge then comes in because then the whole problem stems from the closure of Makerere University, Michelle, because these were medical students. They also said that since they closed the university, we are not going back to hospitals. Now, according to the the program. These medical interns, I don't want to call them some medical interns because they don't like that, but they're postgraduate medical interns. Perhaps that sounds better for them. They said, well, we will not go back to hospitals because part of the program is that they go and offer support to the Mulago National Referral Hospital, which has the majority of patients who have been admitted from different regional hospitals. Now, the fact that the university closed, they said they are not going to come to hospital and they're not going to work. And most importantly, they also raised a very pertinent issue, Michelle, that even though they work day in, day out, spend long night hours in the theater and operating on children and also, doing what they're supposed to do, they are not paid for the services they offer. And according to them, that is not fair. So it stems from that, Michelle, that the Parliamentary Committee on Health went to investigate the issue and they came up with a report that 15 babies were dying daily. Of course, the Minister for Health, that is Sarah Pendi, came out clearly and she said those are allegations that are not true. Of course, putting the number to about 1 baby dying every day, which is also quite a big, even though it's 1 or 15, it's a death registered event. But the health ministry does insist that it is not because these medical interns are not at hospitals, but it's because of negligence. So the medical situation here in Uganda continues to be a subject of debate, Michelle, as we continue to wonder whether indeed it's 15 or 1, it still remains a death registered. Michelle.
I wanted to get from you because the Ministry of Health says that only 31 babies have died in the past month since Museveni closed down the Makerere Hospital, but 31 is still a big number in terms of maternal health care in the country. So talk to us about that and whether any gains have been made in the country.
Again, it's very unfortunate that the minister says only 31. 31 is such a big number. It's a double digit. And Michelle, even if it's 1 baby dying, it's such a big loss to this nation. And I think as a country, we need to get away from just saying only 31, besides away from the 15 babies that die daily. I think what the Ministry of Health needs to address right now pertinently is the issue of medical staff. Now, the medical interns form an appropriate and sufficient percentage of the staff, the medical interns, the postgraduate medical interns. These are senior doctors who have gone back to school perhaps to do specialization. And so instead of them, they are saying that, well, instead of us coming to Mulago Hospital to come and offer our support, we'll go and work in international hospitals here rather than just wasting our energies. Now, this issue was brought to the attention of the president and, of course, the Minister for Education, who did say that they should go back, that the medical school will remain open while the university is closed. And, of course, they refused. The postgraduate medical interns said, no, we are part of the university and we cannot go to hospital to help with the providing services there. Now, when the president met them, Michelle, I think he made a significant statement. He did come out to say that this is modern day slavery, that people work long hours and that they are not paid. And therefore, he did instruct the officials to work on that challenge so that these medical interns are paid money for them to be able to, sustain their families. They're studying during the day and then they're working at night. Those who are studying in the night, they're working in the day, and they have not been paid whatsoever. So it's a whole big, debate here in Uganda. And of course, it is yesterday the minister exchanged very, very tough words with the chairperson of the Parliamentary Health Committee on that issue. But moving forward, I think what the president needs to do ASAP is to address the medical concerns of the postgraduate medical students so that they are addressed to prevent these deaths. 31 per month is quite a big number. Michelle.
All right, so many thanks for that update. Solomon Saranja there joining us live from Kampala, Uganda. He'll be keeping an eye on the situation there for us.